Page 22. Revitalizing exercise. New research shows the healing power of exercise. The standard weapons in the fight against cancer, surgery, chemotherapy, and radiation, may soon be joined by something far simpler: exercise. New research shows that regular physical activity helps reduce the risk of recurrence of breast cancer and slows the advance of prostate cancer. In a few years, exercise will probably be prescribed regularly for cancer rehabilitation, said Melinda Irwin, an expert on cancer and exercise at Yale University School of Medicine. Exercise will become a targeted therapy, similar to chemotherapy or hormonal therapy, she said. Exercise offers many other advantages. It fights the fatigue caused by cancer treatment, calms anxiety, and helps survivors feel better about themselves and their bodies. There are 10 million cancer survivors in the United States. 22% of them women who have had breast cancer, 17% of them men who've had prostate cancer. Exercise makes sense for most of them to live longer, avoid other health problems, and just feel better. Using exercise in cardiac rehab. Heart attack patients are now routinely put on exercise plans, but workouts for cancer patients are neither prescribed by doctors nor covered by health insurance. We're where cardiac rehab was 20 years ago, Irwin said. Once exercise was shown through research to prevent fatal heart attacks, 12 weeks of rehabilitation became the standard of care for most heart patients. In fact, many hospitals opened cardiac rehab centers. Even with a low level of exercise, people benefit psychologically, said Rita Musanti, an oncology nurse practitioner at the Cancer Institute of New Jersey. With so many cancer survivors in the community, she'd like to see informal networks created to encourage recovering cancer patients. Exercise and cancer recovery. Researchers are working to understand how physical activity helps fight cancer. Their findings so far suggest exercise reduces blood levels of insulin, a substance in the body that causes cells to divide and grow more quickly. Women with high levels of insulin have a slightly higher risk of breast cancer and a much higher rate of recurrence and death. Exercise helps repair infection-fighting T cells, restoring the immune system after it has been damaged by chemotherapy. Exercise reduces levels of circulating estrogen and testosterone, two hormones linked to different cancers. Exercise prevents weight gain and promotes weight loss. Important because obesity is associated with lower rates of survival for many forms of cancer. The path back to health. Most of the scientific work so far has focused on women with breast cancer, but studies have also shown exercise has positive effects for survivors of colorectal and prostate cancers. Among men older than 65, 3 hours of vigorous activity a week was associated with a decline in death from prostate cancer. Exercise is now considered so beneficial that cancer experts are even encouraging patients to begin or resume exercise while treatment is underway. Workouts might need to be scaled back in intensity and pace, but evidence strongly suggests that exercise is not only safe and feasible during cancer treatment, but that it can also improve physical functioning and some aspects of quality of life, according to the American Cancer Society. When scar tissue forms after surgery, it limits flexibility. Exercise can help women who've had mastectomies and underarm incisions restore the range of motion. Becoming active again, said one recovered cancer patient, helped her realize that cancer is not a jail sentence. It's a big bump in the road, but you can find your new normal and have a great life. Vocabulary focus. Recurrence. Rehabilitation. Restore. Vigorous. Scale back. feasible, jail sentence, bump in the road.